Then you have the blessings. And may we live without oppression. May we live without oppression in our land. You can see somehow this national anthem is very good because it sets standards by which we must hold leaders accountable. Ladies and gentlemen, once again, good morning and welcome. The next item we have on the agenda is goodwill remarks. Of course, you know that whenever you have events of this nature, they are public events, and which of course is the reason we've had the national anthem. It's always good to hear from critical stakeholders, and amidst we have the public and the private sector, and as well as the development sector as well. So we would like to take some goodwill remarks, and we have just 10 minutes for that. So we expect that those who are going to give us goodwill remarks will do that briefly so that we can move to the next item of the agenda. This event is a two-part event, and we're going to start with a lunch before the technical working group on IPC. So without much ado, I would like to invite we have the MDAs, that is ministry departments and agencies. Are there departments, representatives of specific government departments here? Please kindly indicate, and we'll lend the floor to you to give us your goodwill message. And I'm reminded that we have an online, a virtual community. So members of the virtual community, if you can see me, good morning to all of you. And we're happy and excited to have you join us at this very epoch-making event. So anyone from the agencies, any agencies, do we have anybody from the agencies here? Oh, okay. Please, let's have you give us a goodwill message, your name, and then the agency.
Good morning, all. My name is Rabiu Samuel from National Primary Healthcare Development Agency. So I bring you goodwill message from Dr. Muyi, the Executive Director of the National Primary Healthcare Development Agency. He is really interested in anything concerning, primary healthcare, anything that will help to bring to the minimum or eradication of any childhood diseases, saving of the mothers and the children, especially the people at the grassroots, and also encouraging us to build our capacity so that we can improve services that will render to these people. And so, it's a privilege to be here. And my capacity will say, we hope that by the end of this session, I would have acquired a lot concerning this e-learning and then the whole process, which was a successful deliberation. Thank you very much.
Let's put our hands together for the AD, who is ably represented at this event, and thanks for that goodwill message. Do we have another agency here? Okay. Yeah. Good morning, ladies and gentlemen. My name is Chidi John Okafocha. I'm a senior scientific officer working with the National Biosafety Management Agency. I'm representing my head of department, Dr. Obai Hanga. And definitely, when he told me about this very particular event, we discussed together and shared our minds together and we came to the conclusion that this is a timely one. We can never have enough of such this kind of events or trainings. We can never have enough of it. And as a biosecurity agents, we are hoping to see that in the nearest future, that Nigeria will be declared a biosecured, a highly biosecured country through all our collective efforts. And it's also personally the hope of the agency that at the end of this very particular event, we would have achieved very good information that will help in strengthening the infection prevention and control of in terms of health of Nigeria. Thank you so much. Thank you so much, National Biosafety Agency. We're excited that we're able to make it down to these events. Are we missing out any other agency of government? We've had National Primary Healthcare, we've had NPMA, any other? Is there NACA here? NACA? No NACA. Okay, so let's. Where is NACA? Okay, no, all right. We have CDC in the meeting. Dr. Yemi, can we do a message from CDC? Good message from CDC.
Good morning, colleagues. Again, it's a pleasure to be there, to be amongst our people. I see lots of familiar faces. NCDC is here. See happiness, DRASA. Of course, our host NCDC, and representatives of the ministries, departments, and agencies. Glad to be here, representing CDC. Also bring well wishes from the leadership of CDC, in person of the acting country director, Susan Torres. She will help that as we celebrate today. CDC really is happy to be part of this group. We've seen lots of improvements in IPC, stepwise improvements in IPC over the years. We begin to see, prior to now, we didn't have state IPC programs. That's one major improvement we've seen. Now we have state IPC programs that are manned by competent hands. I'm not sure if there's any of the state IPC focal person represented here, but we begin to have state IPC, state IPC teams that are manned by competent hands. In terms of guideline development, we now have a national policy We have several SOPs that are useful for our day-to-day work as we do IPC. In terms of HI surveillance, seeing improvements there too, because we're already doing a PPS. That's a point prevalence study in a lot of our facilities now. Some surgical site infection surveillance is also happening in our facilities. As regards education and training, we now have, I saw Dr. Dami working as well. We have several of our healthcare workers now that have gone through the EPD course, having a diploma in IPC. And so these are really laudable gains that were made over the years. But we also still understand there are a lot of gaps, and that is why this TWD is really important. For instance, we know that we still need to have more data on HI surveillance. A lot of the facilities are not doing that. We also know that we have over 40,000 healthcare facilities in the country, and how many of them have IPC programs. So those are some examples of places where we know that improvements are needed. But CDC is committed and happy to be part of this journey. Hopefully, with your support, we can get to the promised land. Thank you very much. Thank you.
Thank you very much, Dr. Yemi, for that goodwill. Let me also invite one very strong supporter of the national program. They've always been there, and whenever the national program reaches affiliate to give us some good message. I was looking at someone else.
My name is Elizabeth Adadevoh. I work as an epidemiologist with African Food Epidemiology Network. So it's really very good to be here. And on behalf of our regional technical advisor, Dr. Patrick Mbuku, agreed our warm greeting. Happiness has been a part of this process, just like you said, since the COVID pandemic. We've had several trainings on IPC through our different projects that we implement in collaboration with the NCDC and PHCDA, as well as Resolve to Save Life. So it's really very good to be here, and I'm happy that today we're having this e-learning course launch through our different e-learning platform. We've also tried as possible to capture IPC, and we've gotten very good improvements in IPC across our PHCs. So I think this is really very timely, and we're really happy to be part of this process. So as we deliberate, let's share best practices, insights from our different programs. And I believe at the end of this workshop, the objective of at the end of this meeting, the objective of this meeting will be fully achieved. So I wish us all a fruitful deliberation. Thank you.
Thank you very much. Thank you. Thank you. Ladies and gentlemen, when I walked in here, I had some conversations, and I was made to understand that in preparation for the launch of this e-learning platform, I sat 2 days ago, almost about 390% made attempts to access the platform. That's quite unprecedented. But the bottom line of all of this is the fact that a lot of efforts are actually going into making this or getting to where these things or institutions that have been behind all of this. Please join me as I welcome DRASA, represented by Mariela.
Thank you, and good morning, everyone. It's a pleasure to be here today. I'll stand on all existing protocol and make this short. It's always so encouraging to be in a room full of people committed to pushing Nigeria's IPC agenda forward. For us, the reason we started was because of issues in IPC, the reason our organization exists. So going back to our founding principles, this is very dear to our hearts. It's something we're very passionate about, and we're very happy when we can take time away from the work and come and sit together as a TWG and chart the way forward for the country on IPC. We're very grateful to the national program for providing us with the direction and the strategy that we can execute. And we thank all of the partners here for all of the work we are collectively doing to change the way IPC is practiced in the country. We have a special launch today, which you'll hear more about, but just to say thank you to everybody. We're here, we're ready to support. We'll keep pushing. Thank you.
Thank you so very much. Thank you. And maybe not the very least. We have the president of the Nigerian arm of the infection control. And we would like to also hear from her because she's been a critical stakeholder in all of this process. Please welcome Dr. Bimbola Showende.
Good morning. It's a pleasure to be here. It's a pleasure to be amongst the IPC family in Nigeria. And it's been a pleasure watching from the very humble beginning where we started. And I want to say that NCDC, the Nigerian Society for Infection Control, I bring you warm greetings from all members spread all over Nigeria, the 6 geopolitical zone. The last we had, the theme was strengthening IPC in Nigeria. It's not just strengthening and sustaining it. So I was so glad to say this because this is another way of pushing this agenda forward. And I want to commend NCDC for taking the driver's seat. And I'm sure with this and other efforts, I know CAPS training is still ongoing. There are so many students out there. And by the time we populate the whole of Nigeria, things will change. We'll continue to push and push until something gives way. So together, we're all going to achieve more. Thank you very much. It's a pleasure to be here.
Thank you very much, ma'am. I'm not going to leave here until someone speaks. Just beside you, I land as the representative of the private practitioners, right? Yeah, so that particular community is a very big one. And we know how much benefit this is going to be to our community people. This event is being streamed, I'm sure. Am I correct? Yeah. It's being streamed, so I want to hear from you. Sir.
Good morning, sirs and ma'ams. I am Dr. Amore Olushola, representing the national president of ANPMP. That is the National Association of Nigerian Private Practitioners. His name is Dr. K.A. Adeshola, who is unavoidably absent. And since he holds this work in high esteem, he has sent me to represent him. And like it has been said, you see, the private practitioners, we believe that statistics have shown that we see 70% of people who are, who seek medical attention in Nigeria. And you see, we're at the grassroots. So, I mean, carrying us along will go a long way in effectively implementing this program. And particularly, I'm interested to be here because I am now in full private practice. I retired in 2021 as Medical Director of General Hospital Ifako-Ijai. And of course, I worked a lot with the present Director General NCDC that's Dr. Jide, who was Commissioner for Health in Lagos State. So actually, he choosing me to represent the association. I don't know how he did it, but I'm particularly glad about it because I knew how much the Idris pushed all the health institutions in Lagos State under government, to have an infection control as a priority. So I'm glad to be here, and I know that we are all, doing the right thing in the right direction. And like our mommy said, together we shall achieve more. Thank you all. God bless you all.
Together we shall achieve more. Thank you very much for those very good words, and thanks for lending that voice. Very much. And finally, before I invite the big masquerade, let me invite Dr. Damilola from CCAPS at the Lagos State University to just give us a good message. It's important because we know that similar programs are also being organized by the center. So,
thank you very much. Good morning, everyone. Permit me to stand on existing protocol. Great greetings from our director of CCAPS, Professor Adadevoh. Even though this wasn't planned, but I'm here, and I would just like to say it's beautiful to see how collaborations in the IPC space has led to a lot of progress in Nigeria. I think IPC education and training within Africa, Nigeria has made giant strides, and it's because of the willingness to collaborate. Stations like NCDC, DRASA, CCAPS, and the likes. I think today is a landmark day to be launching e-learning course that people can be a part of and free at that. I think that is profound, and I think we all deserve a round of applause, and it's a beautiful achievement. CCAPS is committed to IPC education training across Nigeria, and like we already are aware, their landmark events happening, training healthcare workers across the entire 6 geopolitical zones. We believe that this will go a long way to improve access to IPC education and training for people that work even in remote places, suburban and urban places. So congratulations to all of us on this landmark achievement, and we're happy to be here. Thank you, everyone.
thank you very much. Earlier I said the very last, but I correct myself because we had a couple of other persons in our midst, and it's important to also hear from them because they are very important stakeholders. Let me invite Chidinma, Institute of Human Virology, Nigeria. A round of applause.
Thank you. Good morning, everyone. Please permit me to stand on existing protocol. I bring greetings from the Executive Director of the International Research Center of Excellence, IHVN, Professor Olashile Abinipu. Like everyone has said, it's really encouraging to see we talk about sustainability. I believe this shows how we have sustained the whole IPC effort here. Considering when the IPC TWG was launched, we've not relapsed. We've continued to have meetings every quarter. It's really encouraging. And then to today's event, the launch of the IPC e-learning course launch. Education is a key component of IPC. So this sets a very good standard for our healthcare workers. So I want to thank everyone for the effort put into this, and I wish us a happy deliberation and launch of the course. Thank you.
Thank you. Thank you. Thank you so much. Finally, from FHI 360, okay, right?
Good morning, everyone. Dr. Ken, who will technical director with FHI 360 on the meeting targets and maintaining epidemic control. So I'll just join everyone also appreciate what we are planning to do here and what we have achieved thus far. I think this has been long coming. Innovations like this are exciting because it brings learning very close to us. So from the country representative, and then Dr. Hadiza Kamofo, the project director, I also bring greetings. And for FHI 360, I think we are also big in global health security. So just a few days ago, there were some persons here when the conversations around continuity of essential health services guideline. But now we're speaking around IPC. We also have recent approvals for strengthening capacity for outbreak response. So I think this is coming in a timely manner, and we'll continue to collaborate with NCDC and of course the partners to ensure we can strengthen what we do as a country health system. Thank you very much.
Thank you. Thank you. That's good for him. So, ladies and gentlemen, I like to bring forward the leadership of NCDC, and I will be inviting no other than the acting head of department, disease prevention and health promotion at the Nigerian Center for Disease Control and Prevention. Dr. Tochioko, she is online and she'll be delivering some remarks. Dr. Tochioko.
Okay. Good morning, everybody. It is 5:28 a.m. here where I am. So, but I just couldn't help joining this meeting. But first of all, let me bring you the greetings from the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, and also personally bring you my excitement and my own personal thank you to everybody there. We know that our national IPC program, the Turn Nigeria Orange program, has three names, and we always like to, has three things about it, and we always like to emphasize it. It has a name, the Turn Nigeria Orange. We have our implementation strategy, that is through the Orange Network, and we also have our philosophy, the One Nation, One Plan. And I have heard the buzzword as I listen, together we'll achieve more, all that. So, and Nigeria has been globally acclaimed for getting the national IPC program, the organization, and the setup right. However, we realize that the health workforce, the health security workforce, particularly those ones that carry out infection prevention and control activity as their day-to-day activity, that is the IPC professionals, are very important. That was why over the last couple of years, we have been working closely with our colleagues at the College of Medicine, at the Center for Infection Prevention, Infection Control and Patient Safety, to ensure that Nigeria has trained IPC professionals who are manning IPC programs, who are competent in line with the core competencies for IPC professionals. And we'd like to thank the College of Medicine led by Professor Folashade Ogunshola and her team for doing an excellent job. And this has not gone unnoticed locally and globally. However, when we train these IPC professionals, we also provide them with support in the form of a network of professionals who share the same vision, who understand the need, and who are also working in line with achieving clean healthcare in health facilities. And that is why we are very, very grateful to NCDC, led by Dr. Showande, for providing the graduates of the IPC Diploma in Infection Prevention and Control course with a home, a network of professionals who share similar vision and who they can then go and continue to co-develop themselves together. And that's why we are grateful that last year we were able to have the NC conference together as one family. However, these IPC professionals, one of the main tasks that they then go back to their health facilities to do is to continue to identify training needs of the frontline health workers in their health facilities. And this is where the IPC online learning course comes. We are particularly thankful to DRASA for taking up that initiative. This was done under the Global Fund C19 RM grant, but DRASA went beyond the call of duty. They took it beyond the consultancy and they have developed an excellent product. What is, however, unique about this particular infection prevention and control online course is that it is a tapestry of everything we have done over the last couple of years as a national IPC program. It is not the usual run-of-the-mill infection prevention and control online program, because as we are developing other things and developing the IPC program in line with WHO core competencies, we had identified a particular gap that everybody had missed. That is when a health worker has gone for training, infection prevention and control training, and has heard about all these ideal things, and then goes back to the facility to then implement or deploy all those skills he's learned, and suddenly is faced with the realities of the workplace. So over the last couple of years, we have worked with our colleagues at the Robert Koch Institute to develop an innovative training approach, the participatory approach in learning in systems. And this has become one of the high points of our infection prevention and control work. And I hope that we'll share the link of the NICAID website so that colleagues on the call, I see about 150 something people on the call, can go onto that website and see that product we developed. So in this online course, what have we then done? We have brought together the learnings from the College of Medicine course. We have brought together the usual things you see in an infection prevention and control online course. And then we have added bits of the participatory approach in learning in system to bring to you this blend of bespoke infection prevention and control online training module. I personally will log on and take that course. And I encourage each and every one of us to not only log on, but to be ambassadors of this program, because this is really, really unique. And it continues to lay a solid foundation for us, not only as a country, something we will export and ensure that for every time a patient goes into the hospital and meets somebody has taken this infection prevention and control online course as a health worker, it is my hope, and indeed is my expectation, that I'll be meeting somebody, a health worker who will offer clean care, a health worker who will communicate appropriately, a health worker who has paid attention to working in a team-based way, a health worker who appreciates the impact the globe would have on their work, and a health worker who understands that you can also operate in an error-friendly environment where the target is continuous quality improvement and not playing the blame game. So on behalf of the Nigeria Center for Disease Control and Prevention, I acknowledge all our partners on this call, and I see in the room Affinet, all the people, I can't mention all of them, but we thank you for this collaboration. And as I wrap up, I'll say again that Nigeria has once more received another recognition. We have been asked to also share our story so that it can be shown as a global best practice on how to collaborate and align and work together as a team in a country in the healthcare space. So look out for that. You'll still see us in the global space acknowledged. And I would like all of us to realize that we did it together. We'll continue to do it together. Thank you very much.
Thank you very much, Dr. Tochi, for that very, it sounds smooth and very well packaged. It may be very early in the morning, but she was very calculated. So thank you once again for those remarks and for acknowledging everyone who has been part of this entire process. We appreciate your leadership and that of the team working with you at NCDC. We have here the divisional head of IPC, Dr. Zamil, we have Obiora, we have Ifeanyi, we have Henry, we have, who else am I missing? Okay, I see Swats, my good friend over there. So thank you all, and you guys have been doing a great job at NCDC. Distinguished ladies and gentlemen, we'll move very quickly to the next item on the agenda, and that is the meat of the matter. We're here today to launch the National IPC e-learning platform, and we have someone who is going to do justice to that process. I'm not qualified. That's why I was asked to come as John the Baptist to announce that who has been chosen and in whom, it is well pleased to do this task. Ladies and gentlemen, I know at the end of the day there will be questions, but there will be answers. So to those online, be rest assured that if the questions you have in mind are not answered when the presentation will be done, Then, of course, it will be addressed at the end of that presentation. Ladies and gentlemen, join me without further ado to welcome Professor Jerome Dugan.
Awesome. Thank you. Thank you, Ibian. The introduction was bigger and larger than the person who is going to make a presentation. But welcome to the official launch of the National IPC e-learning course. Tochi said something about DRASA, but I would like to start by saying a few more words about DRASA, because we worked very closely on this project. DRASA is persistent, consistent, patient, deliberate, and systematic. I especially like their patience because they could send something and we'll review and we'll say yes, but, and when they send it again, we'll say no. And they will send again and we'll say maybe. But they will send again, I will say very likely. And when everything is put together, we'll say, not sure anymore, can we go back? But throughout all of that, they kept their nerve, they were patient, they were consistent, they were deliberate, they were systematic. It is not often that you have such a pattern. Let's clap for DRASA. It has always been a pleasure to work with them. We started this in 2019, and we look forward to continuing on this journey. But now today, let's talk about this e-learning platform that we want to launch this morning. So let's get into it. Let's go to the first slide. Let's talk about the background. You know, in this hall and those connected online, we do not need to give statistics, but healthcare-associated infections as well as antimicrobial resistance continues to be a big problem. Yes, here in Nigeria, we're not so sure of the data. We do not have complete data. But when you look at the data in terms of the African region, it continues to be a problem. And that is one of the things that in IPC we are pushing to reduce to the barest minimum so that we can have self-care. So that is one motivation why there is need for this course. We talked about CCAPs, we talked about other areas, HFC, 360 and others have also said that they have snipers of trainings and so on and so on. But in the context of having standardized IPC training, where we can say what we hear about that is IPC training in location A or Z, we are speaking the same language, is still somehow a challenge. Many people do not have access to that. And if you go down to the grassroots where we are talking about the primary health care setting, for example, this is really a need. We also have the challenge that the conventional IPC training, for example, the one that we are all happy about, what is going on now from CCAPs, that is our gold standard, at least
for them. That's our gold standard. And if we could wave a magic wand, all persons working in health in IPC will just wave this magic wand, and all of them would progress and have the diploma in infection prevention and control from CCAP. But we can, it takes a while, but even more, it takes money. This morning I was told the average cost. And you can tell us if that's not true. It's something we want to achieve. In the future. So what is the solution? Let's have a stopgap. Let's have the online IPC course. So that's the background. Why this is the motivation why we need this course. Now, let us answer the question of why. This one is the motivation, but let's answer that question. Why is the IPC learning course important then? One, it's cost effective, it's free. Well, relatively free, because nothing is really free. It's online, so those accessing it will at least need data, right? So it's comparatively, relatively free in that regard. But it provides health workers with what they need at the minimum to do what is needed in their work context as IPC practitioners in the healthcare setting. Plus, it is iterative, it is recursive, which means that unlike conventional trainings where you attend the training and all you have are the notes you took, this one, you can go back and look at it, and go back again, and go back when you need to actually use it, and go back again. It is there. That alone makes it really attractive. And it makes it easier to strengthen compliance. We're talking about setting up IPC programs in health facilities and so on. In some facilities, they are really bereft of anything. They do not know what they are supposed to do. But with this, they have a starting point. So this course also aligns with many of the things that at the national IPC program we want to achieve. Tochi just mentioned that we have our national IPC program, the Turn Nigeria Orange. So this is one way that we will strengthen the culture of hand hygiene and the culture of IPC in health facilities. So that links well with our national program. It also links well with the AMR NAP Objective 4 to improve implementation of IPC programs, biosecurity. Who is my biosecurity man here? Yes. So, and vaccination update, including access to WASH across the One Health sectors, the One Nation, One Plan. So this course aligns with that. And I don't know how many of us know that we have a draft national IPC strategic plan. We already have an approved national IPC policy. And we're working along those lines to give that policy some teeth to bite, also through the legal framework. So it aligns with all of these priorities of government by means of the national IPC program. How did this course come to be? I already gave you a snippet on the back and forth with DRASA. it was tedious, it was stressful, and excitingly challenging. So DRASA was contracted as a consultant to work this job. I love their humility because I'm aware that in DRASA, there is competence, there's technical competence in IPC. But I can tell you that they always deferred to NCDC we worked out what the outline would be, what the curriculum would be. We worked it out together, and we worked out what should be in or out. But not just at that level, we worked out together the content and the variety of offerings within it. I respect them very much for this. Because I'm wondering if I was that competent and I was called upon as a consultant, maybe I would just say, here we have done this, you take, bye-bye. And this I'm saying is not earlier, I hired a consultant to do something similar. And each time we held a meeting, it ended in agreement. I have no knowledge of the background of that consultant and the consultancy. But they will offer us something and we will say, can we take a look at this? And it will result in a forum and it will end in agreement. Apparently, it is that agreement that continued until they submitted what they submitted, but Nigerians never saw it. So when I say that I appreciate the way we worked on this, I'm not just guessing what would have been. So there was very fine collaboration between DRASA and the NCDC IPC team to develop this from the concept to the nature of the curriculum, to the content, and so on. And then when we had a draft, we made sure that some people tested it outside those of us who would obviously have blind spots. Because if you are looking at something and developing it yourself, there are certain things you may not look at. So we gave it to the wider community to test it. And we fixed those feedback we received. And we worked also with the ICT team. We told them what we wish would be possible, and they told us what was possible and worked through that. And here you have. So this is how we developed it. Let's move on now to the course itself. You know, this is a self-paced course. You don't have somebody standing like I'm standing here talking to you or something. So we took into consideration how adults learn generally. So if you populate a course with so much text after text after text, many people will be put off. They will not open. They won't do it. They will start, but they will leave it. Especially because there is no carrot or stick attached to it. People walk that way only if there's a stick and there's a carrot. But otherwise, they will do the way you use Google. You know, Google provides so much. You open, you read 2 lines, and you say, I'm done, and so on, that kind of thing. So there's a variety of content. There are videos, infographics, there are quizzes. I especially like the activities because learning takes place more when people do. Adults learn by doing. And we have very enticing activities that encourage you to do. So we have those, we have done somehow, and there are many resources and links so that those who want to move further can do so and get more knowledge and information. So that's about the content. This course is actually a basic course. We consider it as work in progress. So it has 4 sections only. But as we are gathered here and those connected online, as we see the uptake of this course, we would very likely go to stage 2 and eventually go to a possible stage 3 in that order. So this one has 4 sections only. The first section is an introductory section which tells us helps as learners, the learning pathway, creates the learning pathway so you know how you can walk through this course and succeed and do well. Then it also gives us an overview and things that will support the learner, basically the learning pathway. The section 2 talks about introduction to infection prevention and control. It mentions something about our national IPC program, the Turn Nigeria Orange. Then, like Tochi was mentioning, it also introduces us to the participatory approach to learning assistance PALS. Many of you may be hearing about for the first time, but maybe you should go online and check that out. So section 2 handles those. Then there is section 3, which we made sure that it wasn't the dense kind of thing that many of you may be familiar with. So what you see, introduction to standard precautions, there's also transmission-based precautions, because actually transmission-based precautions are those added disease-specific precautions in addition to the standard precautions. Isn't that the case? So we made sure that we presented that in a very light, interesting, but comprehensive way in that section. So we consider those things without being too academic, because even those who are attending CCAPs, I hope the CCAP people are not here. They are not here. Even those people attending CCAP who want to be IPC professionals sometimes get overwhelmed by what is presented. So it's possible to present some of those things in such a way that you can smile and still get it and so on. But you know, there are all those old traditions of how we were taught in medical school. Don't deviate from that. Make them suffer. But stress them very well. They know that professionals. You know, we had that conversation with the director of CCAPS late in 2019, Gigi, along with other members of our team, because we went to the CCAPS to June 2019. That's where I first met Nini. I thought she was just a photographer because she was doing so much expert photography, and I told her, wow, I love this photography and a fine camera. I didn't know that I was dealing with a genius. I tell her that big things come in small packages. Anyway, so but that is not the way that this is presented in section 3. Section 3 puts standard precautions as well as transmission-based precautions, which is in such a way that it's a delight, even for those who are approaching IPC and these matters of standard precautions and transmission-based precautions for the first time, because we took as our base people who are working in health, who need to know basic things about IPC, but who have not had the elite privilege of learning about it from other sources. That is the way you will see this course. And then section 4 closes the course. Where we also intersperse in every section with some activities, some quizzes and so on, we did some kind of final assessment somehow there in section 4. And then we congratulate you when you have done that. You do an assessment. Can we go to the next slide? You go an assessment and then we're done. So let's walk through this group. What you see on the left is what you will see when you open. What you see on the right is the how you should go about it. And we're on the same page. So on the right, you have go to the NCDC website, www.ncdc.gov.ng. When it opens, that's how it will open there on the left. And you see that circle, e-learning. There are menus up there, and one of the menus is e-learning. Click on e-learning. When you click, then you will see there are other things on that menu. One of them, you will see there, IPC infection prevention and control. Click on it. When you do that, it will bring a registration form for you to complete. There are two reasons for completing this course. The obvious reason is to give you access to the course. But there's another reason. When you have completed the course, it will also help us to track how people have been using this course over time. So we can collect data to say that we have this category of head workers at this level, even for this region, and so on, who have done this and so on. We can really calibrate it to know in terms of duration between this time and this time, who did so, and that kind of thing. So then you fill this registration form, and when you're through with it, you will get an email in your own mail that now grants you access. Can we go to, yes. So when it will give you this, you fill your username and password, and then your team. Now it is personalized. Now the system knows you, it knows your name, knows everything about you, and now you have a username and password and you're in, so you go to my course. This is where you always go to my course, because you may not do everything the same time. You may go, it's self-paced. So every time you go back, you go to my course, you use your username, use your password, go to my course and continue where you want. So this is the course introduction. On the left is the outline. And here in the middle are the details that you complete. And when you finish, you say this section is finished. Remember that there are 4 sections. Yes. Let's go to the next. This is how the welcome page looks. And I think this was the page that was advertised in sending out the link. And this is how the registration form that we showed you previously looks. And our activity, the first activity, one of those activities, a drag and drop activity where you have options. This is another activity that you will see. And you can see when you are through, you move to the next section. Let's move. And there's a small video on bars. I like that video. It's good to use technology. Yeah? I think in that video, we also captured Chikwe doing the official unveiling of PALS. Can you imagine if we didn't do it at that time? And because the first Director General of NCDC was also the foundation of this initiative that has become part. So then you have multiple choice questions, which have become very commonplace in this field. Then you have other activities that you have to sort. Okay. And then there is an online discussion forum. I especially like this because in asynchronous online learning, the community, building that online community is part of the biggest strength of this course. Because you have a network of people from everywhere that you can access, you have access to. In the face-to-face class, even in CCAPs, you don't have that kind of opportunity, you don't have that privilege, except if you are in the same cohort, in the same class. But online, everybody from the high and mighty to the ordinary beginners like me, we can benefit from available expertise and skills and experience by means of this forum. So I think Vygotsky talked about the more knowledgeable order, which is a very big thing in learning. By means of this kind of online communication, we can ride, those of us who do not know can ride on the shoulders of giants. Can you imagine the person in that remote place in the primary healthcare setting who has access to this course and ask a question that to him or to her is a big challenge, but to you, it's just a common sense question. So you just answer the question and the person goes back to their own work and they're happy. So we have that. We also have short answer activities. These are different, just different kinds of activities. You have matching activity, and then you complete the course. So I'm going back to the preview again. So you get to the course completion, and you'll see congratulations. What follows your congratulations? After you have finished your final assessment, which I talked about, this is what you get. You can clap for yourself because you have done all this. The next slide says, what's next? Next steps. And the next step must conspire to propagate this course on all the platforms that we have access to and encourage those within our own domain to use the course. We want to see by the end of June that we have thousands and thousands and thousands accessing this course and using it. Then we can make a case to our employers and say, it is time we began to work on version 2. Thank you very much.
I told you earlier I wasn't qualified to do this. Now you can affirm. But I said, round of applause again to Dr. Jerome Stoga. Before you become so comfortable, sir, there are questions. I have a couple of questions here. One principal wants to know, he said, will this e-learning course be available to medical students in the clinical arm? So you want to know, and then there is an anonymous there is also a question from one anonymous. Will there be any diploma awarded following the completion of this course? Yes. That is the Oliver Twist of the whole. So, two questions for you. Any other?
Question number one. This course is available to everyone who has an internet connection, and it is without charge, and you can do it many times as you want. Question number two. Remember that we said that this is just the first part of the course. It's just IPC basics, basically. So, and I said, we are likely going to do another one, and another one, and another one. You cannot get a diploma with this one. But we will offer you a certificate that you saw there, offer you a certificate of completion. Matters of diploma will come later. No one seek out to tell police.
Thank you very much. All right. It's been a very wonderful time, ladies and gentlemen. We've all heard. We now know what the next step is. And I love the word they use. They say, we all conspire. Very heavy word, conspire to aggressively invade. It sounded like the Great Commission. Go ye into the hinterlands, wherever. Okay, so that's what we've been asked to do. But I think if you want to do this even more effectively, it's to also show that you have done the course, which of course is the reason Dr. Tochi said she will also take the course. And I'm also committing to take the course so that when I have my certificate, I can say, you know, that link I sent to you, have you done it? To do it, see my hand. So that way it's easier. When you do it, it's easy to convince other people to do that. So, ladies and gentlemen, we have the call for action. I was told earlier that the tea is getting cold, and I'm worried because some people like the tea hot. Me, I don't like it hot, but many people like it hot. Okay, admin had gone to call them. So we'll have the tea when they are here, and then we'll move into the second part of the program. That is assuming we don't have any other questions. So we've had questions from online, but from the group here, I'm sure we have one or two questions or comments. This is the time, and we'll be glad to hear from you. What's your take? What's your feedback? Think it's a good idea? I think it is, but let's hear from you. That's my personal opinion. Yes, anybody? She wants to go first.
Thank you.
Yeah, I heard Prof. He said it's self-paced, so you can go at your own pace, and that no one is standing with a whip and a carrot. But any other? Yes.
Thank you so much, Prof, for that presentation. I think I was trying to look for you. Yeah, so I think it's a very good learning avenue. But my question is related to the online community. I don't know how that works. If you could actually expatiate further on that. How do we have dedicated personnel that would actually look into some of those questions that are posted in that online community? I just want to have an idea of how the online community works. Thank you.
So it was definitely distracting. I can assure you. I didn't get a question, but
So I said the online community. I would just want to have an idea of how the interactions there would be. Do we have dedicated personnel, maybe from, I don't know, from experts that would actually interact, so that we'll avoid a situation whereby people start giving, false responses and things like that. I think it should be monitored. I just want to have an idea of how it works.
that's a very good point. Mignola, do you want to address that? Yeah.
Yeah, thank you for that question. It's very important because the community element of this is something that we felt was very important for peer-to-peer learning and exchange of information. So yes, it will be a moderated platform. Members of the IPC team and NCDC have access to it, as well as the ICT team, to confirm and clarify when things may be going off. But the idea is really that we want to generate participation, not just you take the course for your own reasons and you walk away with your certificate, but you contribute to the community. Without giving away too much, I would say that some of the community elements are actually mandatory to move to the next section. So it's very important that we also share and exchange ideas and successes and failures as part of the learning process.
Excellent. Yes. Getting interesting.
Thank you so much. I just want to also talk about that online community. I did a course online, and in that community, you know, they used the community to assess teamwork. So in this regard, we were sending scenario, you know, for us to work on, and then everybody will have to comment on the scenarios. You put your answers, and then you also put your reference. And so those reference were also very marked and checked. But at the end of every there will be a timeline. You know, you have to answer these questions from maybe 1st to 25th of this month, and everybody's answers will also generate another answer. If in case somebody answered answer, you can also answer the correct and then give your feedback and also reason why. And then at the end, your scores will be analyzed and sent to you privately. Thank you so much.
Excellent. I think from the contribution, it appears online programs, whether self-paced or those that are concurrently moderated, have inbuilt mechanism to ensure that no one is left out and that there is that cross-learning, you know. So I'm happy that all of these things that, and of course, the designers of the course are here, so they are taking note. And as we go from here, all of these feedback will definitely be part of the improvement process. I have Prof say work in progress, so which means that activities online are going to be closely monitored, just like Niola has hinted, and so that the experiences of people can be harvested and used to actually improve the entire program. So this is actually novel. It's wonderful, and I'm really excited that, you know, we have this initiative. Yes.
Thank you, and kudos to DRASA. So just a suggestion, I was discussing with Mudamil, if we can consider adding CPD points, especially for the different cadres of the health professionals. We had an online course and we saw that as a really, really motivating factor. It really increased the uptake of the course as well as the completion rate. Thank you.
Honestly, cannot agree more.
Yeah.
Thank you so much for bringing that up. Yeah, I know the DRASA team is taking note of this. So, yes. Obiora, did I see your hand up? Oh, okay. All right. Any other contribution? And before we break? Okay. Okay. Yes.
Right, thank you very much. So I just wanted to, I'm making assumptions that we should be able to track the time spent on the course and the time for completion for each individual. I'm looking at, I don't know if I saw that and I stepped out, feedback from, and we also have that feedback. Okay, it's there. Okay, I didn't see.
They talked about there's a community platform, okay, where those feedback would actually be relayed, and also there's someone to monitor the community. It was mentioned, it was a question actually, and the DRASA team addressed them when the response. Okay, so Niniola, did you get his question? Yeah, please, so that.
Thank you for that. The data generated by this is actually something we're going to be paying very close attention to as we seek to refine and improve the course over time. So your point about duration, time spent to completion, time spent on each module, pass rates of each quiz, activity, and all of that, those are all the things we'll be analyzing as we go along. But in addition, you also mentioned feedback. So there is a feedback form that's mandatory at the end of the course. So everybody has to say something about their experience in taking the course. So we'll get that feedback. Thank you.
So. Thank you. Okay. Any other question? Yeah, I know. So if there is no other question, and Obiora, no online question, right? Okay. Okay, so for our participants online, we want to thank you for your patience and for being part of this e-learning course launch. We are about going into the second part of today's event, and so we are granting you the exit permission, and you can do that either at your own time or we can request AJ to help us do that. So thank you once again, and please don't forget to take this course, very important, and share the link. Okay, great. So we are asking them to share to their networks here. All right, so for a few minutes from now, we're going to break for tea. They've requested we give them just 10 minutes to thank you. The tea was originally set for 10 o'clock, but we requested that that coincides with the takeoff of our program, so they should move it forward. So, and it has to be warm or hot, as the case may be. So they're getting that ready. Yes.
Explain to us about some of the.
I think so. If your name and email is on that registration link, you will definitely get the link. Obiora, can we do that? To everyone who has registered, a link to this course. Yeah, so that you'll get it. Yeah. Yeah. You definitely get it. You'll get it. I'm also looking forward to it, because I want to be an ambassador. All right. Some suggestions on how to share the link.
It's on the screen already.
Okay, so that's it on the screen, but it will also be sent to your emails. And I've just been informed that it will also be sent to your WhatsApp number. Okay, great. So I think we all deserve a round of applause today. Yes. Shortly, we will go into the second part of the program. And you will notice that when we started, we didn't do any introduction, right? Yeah, because we were here for course launch. So for the second part of the program, which is the technical working group, we are going to have that introduction. We don't want to proceed on the assumption that we all know everyone here. There are a couple of persons I don't know, either by name or